Hello, everyone. Before I get started, I wanted to offer my condolences to the victims and to all those grieving after the horrific shooting in Vienna that started in front of the city's synagogue. We stand by the people of Austria and Jewish communities around the world who are reeling from this attack. There have been too many of these unacceptable acts of terrorism and violence in our world recently, including in France over the last few weeks and at Kabul University in Afghanistan yesterday. Canada stands united with people everywhere in condemning these latest terrible attacks. Ces jours-ci, notre monde fait face à des défis de toutes sortes. De plus en plus, on voit que la deuxième vague de COVID-19 donne de la difficulté à plusieurs pays d'Europe et d'ailleurs. Le Royaume-Uni a annoncé une nouvelle phase de confinement. La Belgique et la France connaissent une hausse fulgurante des hospitalisations. Leurs infirmières et leurs médecins sont épuisés et leurs hôpitaux sont débordés. La situation est inquiétante et il faut la prendre au sérieux. The second wave of COVID-19 in places like the UK, Belgium, and France is a wake-up call that Canadians cannot afford to ignore. Right now, this virus is being given the chance to spread. It's being given the opportunity to grow. I know that's hard to hear, but the numbers are showing us that our window to turn this around is closing fast. We have to work together right now to beat the second wave. It won't be easy, but I know we can do it. Just yesterday, I spoke to Dr. Tam and to our caucus from Manitoba about what that province needs to do to deal with their latest surge in cases. On top of the federal support we've already provided, from the Safe Restart Agreement to the Safe Return to Class Fund, we're taking additional measures. Already, we've delivered to Manitoba over 90,000 rapid tests. Nationwide, the number is more than 2 million rapid tests shipped to the front lines. For Manitoba in particular, we're also providing federal support on contact tracing, modeling, and COVID-19 test processing. And we're shipping out PPE and working together on support for measures like isolation housing. There and right across the country, we will continue collaborating with all orders of government to keep Canadians safe. But governments can't do this alone. We need your help too. So please, limit the number of people you see to what is absolutely essential. Download COVID Alert. 5 million people are now using this app. And keep wearing your mask, washing your hands, and staying 2 meters apart. I know it's tough, but it'll be even tougher if we give up now. We flattened the curve this spring. It's time to do it again this fall. Depuis le début, nous travaillons avec tous les ordres de gouvernement pour assurer la sécurité des Canadiens et pour maîtriser cette deuxième vague. Mais on ne peut pas y arriver seul. Alors, s'il vous plaît, limitez vos contacts en personne à ceux qui sont absolument nécessaires. Téléchargez l'application Alerte COVID. Il y a déjà 5 millions de personnes qui l'utilisent maintenant. Continuez de porter le masque, de vous laver les mains et de garder une distance de 2 mètres avec les autres. Je sais que c'est difficile, mais ça va être encore pire si on abandonne maintenant. On a aplati la courbe ce printemps et on peut le faire à nouveau cet automne. Over the last few weeks, I've been speaking with business owners across the country. And while this virus is no match for their resilience and creativity, I've heard how worried people are about the second wave. So on that front, we're taking yet another step forward. Today, I can announce that the CanExport program is pivoting to provide new support for small and medium-sized businesses on e-commerce, online platforms, and virtual trade events. There will also be additional resources to help business owners navigate COVID-19 trade rules and dedicated help for women and Indigenous entrepreneurs. Many small businesses have been able to stay open because they moved online. We want to grow that potential. Not only is this a great way to make sure that local shops can keep serving their neighbors, It's an opportunity to expand into global markets and rebuild a strong, resilient economy when the Canada brand is strong. Que ce soit ici ou sur les marchés mondiaux, on sera là pour les Canadiens tout au long de cette deuxième vague. Hier, la vice-première ministre a déposé un projet de loi visant à mettre en œuvre nos nouvelles mesures de soutien ciblées pour les entreprises durement touchées. Ces mesures comprennent notamment la nouvelle subvention d'urgence du Canada pour le loyer, ainsi que la nouvelle mesure de soutien en cas de confinement. Le projet de loi prévoit également la prolongation de la subvention salariale qui aide de nombreux employeurs et employés. J'espère que tous les parlementaires appuieront l'adoption rapide de ce projet de loi important pour venir en aide aux travailleurs et aux propriétaires de petites entreprises. Tout comme cette pandémie a été difficile pour les propriétaires de petites entreprises, elle a également été difficile pour les agriculteurs. Au cours des mois à venir, nous continuerons d'être là pour les femmes et les hommes qui nous aident à mettre de la bonne nourriture dans nos assiettes. Aujourd'hui, j'annonce un investissement de 7,5 millions de dollars pour soutenir les agriculteurs québécois par le biais du Fonds d'urgence pour les mesures de soutien à la ferme. Cette somme fait partie de notre investissement de 35 millions de dollars visant à soutenir les exploitants agricoles et à assurer la sécurité et la santé des travailleurs canadiens et des travailleurs migrants partout au pays. Tout le monde mérite d'être en sécurité au travail. Les travailleurs agricoles sont là pour nous et notre gouvernement continuera d'être là pour eux. I want to end this morning by offering my deepest condolences to the family, friends, and CAF colleagues of Corporal James Choi, who we tragically lost over the weekend. We are here for you as you mourn this terrible loss. Those who knew Corporal Choi describe a dedicated, hard-working young man and a natural leader. He will be missed. As we mark the start of Veterans Week this Thursday, we'll have the chance to honor the service and sacrifice of Corporal Choi and of so many others. Our women and men in uniform have stood together in defense of a better world. Let's remember their legacy and do our part to carry it forward. This year, many remembrance commemorations have moved online, so go to veterans.gc.ca/Canada Remembers to join in. You can also pick up a poppy at a box in your neighborhood. They've set things up for touch-free donations, or create a digital version at mypoppy.ca. Cette semaine, particulièrement, on se souvient du courage et des sacrifices de ceux et celles qui ont servi et continuent de servir notre pays. Leur bravoure nous a offert un monde meilleur et ils resteront toujours une source d'inspiration pour nous tous. Merci. Je suis maintenant heureux de céder la parole à la vice-première ministre. Chrystia.
Thank you very much, Prime Minister. Yesterday afternoon, our government introduced legislation to put in place new support measures to help businesses get through the second wave of the coronavirus, to help them keep serving their customers, keep employees on the payroll, and get through to the other side. First, the new Canada Emergency Rent Subsidy, which will provide direct and easy-to-access rent and mortgage interest support directly to tenants and property owners until June 2021. The new rent subsidy will support businesses, charities, and nonprofits that have suffered a revenue drop by providing support up to a maximum of 65% of eligible expenses until December 19, 2020. Our legislation will allow for retroactive claims to September 27th. Deuxièmement, le nouveau programme de soutien en cas de confinement qui offrira une subvention supplémentaire de 25% par entremise de la subvention d'urgence du Canada pour le loyer aux entreprises admissibles qui sont assujettés à un confinement et qui doivent fermer leurs portes ou limiter considérablement leur activité en vertu d'une ordonnance de santé publique. Conjointement, cela signifiera que les entreprises durement touchées par un confinement pourraient recevoir une aide au loyer pouvant atteindre 90%. Lorsque plusieurs régions de notre pays luttent contre une deuxième vague de coronavirus, ce soutien est particulièrement important pour nos entreprises et notre économie. Second, we are proposing new lockdown support. This will provide an additional 25% through the Canada Emergency Rent Subsidy for qualifying businesses that are subject to a lockdown and must shut their doors or significantly restrict their activities under a public health order. Combined, this will mean that hard-hit businesses subject to a lockdown restriction can receive rent support of up to 90%. As much of our country is fighting a second wave of the coronavirus, this support is especially important now for our businesses and our economy. Third, the extension of the Canada Emergency Wage Subsidy until June 2021. This will continue to protect jobs by helping employers keep employees on the payroll and rehire their workers. The wage subsidy will remain at the current rate of up to 65% of eligible wages until December 19, 2020. Pour avoir une relance forte et durable, nous devons faire la bonne chose maintenant en termes de santé publique. Regardez autour du monde. Il y a trop de juridictions qui, en espérant avoir gagné la lutte contre la pandémie, se sont précipitées à ouvrir. Le résultat est que le virus s'est propagé encore plus rapidement. L'argent qui était supposé agir comme stimulus a été gaspillé et l'économie a été plus durement touchée qu'il y aurait dû. To have a strong and sustainable recovery, we need to be sure that we do the right thing now from a public health perspective. Just look around the world. There are too many places that, hoping the pandemic was beaten, rushed to open up too soon. The result was a resurgence of the virus, and the money that was pumped into economic stimulus was wasted, and the economy is being hit harder than it should have been. The business support measures that we introduced in Parliament yesterday are designed to support the difficult work of our public health officials and the agonizing decisions that they must make. If our public health officials believe that limited lockdowns are the best way for us to fight the coronavirus, the federal government will step in with additional support for affected businesses, as I have outlined. This is to help communities do the right thing and stay safe, and to help the affected businesses get through to the other side. This is the right thing for us to do, and it is the economically smart thing for us to do. I hope that all members of Parliament will support swift passage of this important legislation. Merci beaucoup. Mary, je te donne la parole.
Thank you so much, Deputy Prime Minister. And this legislation, of course, is another step towards ensuring that our small businesses can make it through this crisis, as well as rebuild and to position us for an economic recovery. Bonjour à toutes et à tous. Helping Canada's small businesses go global is a key driver to helping our economic recovery. Our innovative and resilient small businesses across Canada continue to find ways to translate today's challenges into tomorrow's opportunities. And we can't start soon enough doing this. We need to be there to position them for that economic recovery. We need to create the right conditions for them to go globally. We need to give them the right tools to give them the support that they need. Aujourd'hui, comme l'a dit le Premier ministre, nous annonçons de nouvelles mesures pour aider les petites entreprises à croître tout en naviguant parmi les défis posés par la pandémie sur le marché mondial. Back in 2016, our government launched the CanExport SMEs program, and to date, that program has helped thousands of small business owners and entrepreneurs break into international markets with funding of up to $75,000 to help them cover travel costs and other expenses. Of course, given the international travel restrictions that are in place because of COVID-19 and the increased importance of digital trade and just doing business digitally, the CanExport program is now pivoting. We're going to have this funding help businesses explore international opportunities in new ways. Number one, the support's going to help them develop and expand their e-commerce presence by covering partial costs for online sales platforms and digital strategy advice, as well as advertising and search engine optimization. Number two, this will help entrepreneurs and businesses attend virtual trade shows and other virtual business-to-business events. Number three, it'll also help small business owners navigate the new COVID-19 trade barriers by helping them pay for international market certifications and requirements. And as well, the CanExport now will provide dedicated support for Indigenous and women entrepreneurs to help them adapt to the economy of the future and to succeed in the marketplace amid COVID-19. So this revamped CanExport program will help hundreds of small businesses in the coming months sell their world-class Canadian goods, services, and technologies in the international marketplace, grow their business, and create good jobs for Canadians. So whether you're a female entrepreneur from Quebec, an Indigenous entrepreneur from Winnipeg, or a owner of a clean tech firm in BC, I encourage you to check out CanExport, learn how it can help you go digital and help you grow your business. And this week, starting tonight, I will be participating in Canada's first ever trade mission, virtual trade mission to South Korea. Out of the nearly 200 entrepreneurs and businesses joining me, including many female entrepreneurs, dozens are taking advantage of this new revamped CanExport program so that they can access those important customers in the international marketplace in South Korea and across Asia. Today's announcement builds on the work we have done for small businesses to help them rebuild, continue to bridge them to better times beyond COVID-19, and certainly with this support to help them do their business and to do their business globally. We will continue to listen, to adjust, and to respond to their urgent needs over the weeks and months to come. And now I will pass this on to our top doctors for an update on COVID-19. Merci beaucoup.
Bonjour à toutes et à tous. There have been 240,263 cases of COVID-19 in Canada, including 10,208 deaths. Nationally, there are about 30,000 active cases across the country. And over the past week, labs across Canada have tested an average of close to 61,000 people daily, with 4.7% testing positive. Yesterday, a total of 3,422 cases were reported nationally, excluding Alberta, which has not yet reported weekend or Monday cases nationally. 741 of the new cases were backlogged from the weekend, and 2,681 were newly identified yesterday. This brings the average daily case count to over 2,900 cases. There are also increased numbers of people experiencing severe illness. Over the past 7 days, there were, on average, almost 1,100 people with COVID-19 being treated in Canadian hospitals, including over 215 in critical care and an average of 34 deaths reported each day. Canadians have sacrificed much in the months since the pandemic first began. We have come together to protect one another. Masks are one of the ways we protect each other. The degree of protection that non-medical masks provides varies with the construction, the number of layers, materials used, and most importantly, the fit of the mask. To improve the level of protection that can be provided by non-medical masks or face coverings, we are recommending that you consider a 3-layer non-medical mask which includes a middle filter layer. To find more information on how to purchase or make and wear your non-medical masks for most effective use, read our updated guidance. It is important to remember that masks are an additional layer and that core public health practices, including staying home if you have symptoms, hand washing, and physical distancing remain vital protections. We know from the evidence in Canada and internationally that larger gatherings and indoor settings pose a higher risk for infection. The virus that causes COVID-19 spreads from an infected person to others through respiratory droplets and aerosols created when an infected person coughs, sneezes, sings, shouts, or talks. The droplets vary in size from large droplets that fall to the ground rapidly, within seconds or minutes, near the infected person, to smaller droplets, sometimes called aerosols, which linger in the air under some circumstances. This is why we have been advising Canadians to try to avoid the 3 C's: closed spaces with poor ventilation, crowded places with large numbers of people gathered, and close contact situations where you can't maintain physical distancing. This pandemic is teaching us a lot about being flexible and adapting to new challenges. Thank you.
Bonjour à tous et à toutes. Il y a eu 240 263 cas de COVID-19 au Canada, dont 10 208 décès. Il y a environ 30 000 cas actifs au pays. Au cours de la dernière semaine, les laboratoires de l'ensemble du pays ont analysé des tests de dépistage de près de 61 000 personnes par jour en moyenne, dont 4,7 % ont reçu un résultat positif. Hier, 3 422 cas au total ont été signalés au pays, à l'exception de l'Alberta, qui n'a pas encore communiqué ses chiffres de la fin de semaine et de lundi au niveau national. De ce nombre, 741 étaient de nouveaux cas accumulés au cours de la fin de semaine et 2 681 étaient de nouveaux cas enregistrés hier, ce qui porte le nombre de cas signalés à plus de 2 000. Le nombre de personnes présentant des symptômes augmente également. Dans les hôpitaux canadiens, dont plus de 215 en soins intensifs et 34 décès chaque jour. Les Canadiens ont fait beaucoup de sacrifices depuis le début de la pandémie. Nous avons fait de nombreux efforts pour nous protéger les uns les autres. Le port de masque est l'un des moyens non médicaux et le privilège. Nous vous recommandons d'utiliser un masque non médical à 3 couches, qui comprend une couche intermédiaire filtrante. Pour en savoir plus sur la façon d'acheter ou de confectionner un masque non médical et de le porter afin qu'il soit le plus efficace possible, veuillez lire nos directives révisées. Rappelons que le masque est une couche supplémentaire et que les mesures sanitaires de base, comme rester à la maison si l'on en a des symptômes, se laver les mains et maintenir une distance physique demeurent essentielles pour se protéger. Selon les données recueillies au Canada et ailleurs dans le monde, nous savons que les grands rassemblements, les activités intérieures posent un risque élevé d'infection. Le virus à l'origine de la COVID-19 se transmet d'une personne infectée aux autres par les gouttelettes respiratoires et les aérosols produits lorsque la personne infectée tousse, éternue, chante, crie ou parle. La taille de gouttelettes varie allant de grosses gouttelettes qui tombent au sol rapidement en quelques secondes ou minutes près de la personne infectée à des petites gouttelettes, parfois appelées aérosols, qui restent en suspension dans l'air dans certaines situations. C'est pourquoi on recommande aux Canadiens d'éviter les espaces clos mal aérés, les endroits achalandés où sont regroupés un grand nombre de personnes ainsi que le contact étroit qui ne permettent pas de maintenir une distance physique. Cette pandémie nous en apprend beaucoup sur la souplesse, l'adaptation aux nouveaux défis. Merci.
Thank you, Dr. Njoo. The Prime Minister will be available for 20 minutes of a question period. Minister Ng and Minister Freeland and doctors will remain available afterwards for questions, starting with the phone today. One question, one follow-up. Merci beaucoup, Dr. Njoo. Le Premier ministre va répondre aux questions pour une durée de 20 minutes. La vice-première ministre et ministre des Finances, ainsi que la ministre de la Petite Entreprise, la promotion des exportations et du commerce international avec les docteurs demeureront disponibles par la suite pour répondre à vos questions. Commençons par le téléphone aujourd'hui. Une question sous question. Nous avons jusqu'à 12h45. Merci. Opérateur, c'est à vous.
Thank you. Merci. Before we start, we please ask journalists to keep their questions for ministers and the medical team once the Prime Minister has left the room. To ask a question, please press *1 on your telephone keypad. Avant de poursuivre, nous demandons aux journalistes de bien garder leurs questions pour les ministres et l'équipe médicale lorsque le Premier ministre aura quitté la salle. Pour poser une question, veuillez faire étoile 1 sur votre téléphone à clavier. The first question is from Chrystia Freeland, The Globe and Mail. Line open.
Hello, Prime Minister. I'd like to ask you about another matter. Specifically, the RCMP had a July deadline to respond to the Civilian Review and Complaints Commission's report on its investigation into the death of Colton Boushie. It's now November, and there is still no response. So why are there not statutory requirements for the RCMP to respond to Commission reports within a set time frame?
On a few different occasions, I was able to sit down with the family of Colton Boushie, and I assured them that we would get them answers on what happened. We are all awaiting this report, and I have asked Minister Blair to follow up on where this report is at and how quickly it can be released.
Following up.
Is there any hammer, though, that you could apply, Prime Minister, to ensure that there is a set time frame in which the RCMP can respond to watchdog reports? And how would you feel if this was your family awaiting answers?
Oh, I know directly from the Boushie family and from victims of incidents across the country that the wait is extremely difficult to find out answers. It interferes with the grieving process. It leaves gaping wounds that are difficult to fill. And that's why, as a society, we need to do better on getting those answers quickly to people. That's why I've asked Minister Blair to follow up on what is going on with this report and ensure that it is released soon. At the same time, I think there is reflection to be had on how to ensure that situations like this and delays like this don't happen again.
Merci. Opérateur, prochaine question téléphone.
Thank you. Merci. Prochaine question, Raymond Filion, TVA. À vous.
Merci. Bonjour, Monsieur le Premier ministre. Le président français, M. Macron, a téléphoné à François Legault ce matin pour le remercier de son soutien dans la défense de la liberté d'expression. M. Legault, hier, s'est dit en profond désaccord avec vos propos de vendredi. Alors, est-ce que vous avez parlé à M. Macron, 1, et 2, comment répondez-vous aux nombreuses critiques à l'effet que vous défendez trop mollement la liberté d'expression?
Comme j'ai dit vendredi, les actes terroristes, les actes haineux qu'on a vus en France sont absolument inacceptables et absolument injustifiables. Il n'y a aucune justification pour cette violence. C'est ce que j'ai dit et c'est ce que je continuerai de dire. Comme j'ai aussi dit, nous sommes de tout cœur avec nos cousins français. J'ai exprimé mes condoléances et mon appui. J'ai travaillé et je travaille depuis longtemps avec le président Macron, avec qui nous partageons énormément de valeurs. Nous allons toujours être là pour lutter contre le terrorisme, pour défendre nos valeurs, pour travailler pour la protection de l'environnement, pour protéger les femmes. On est de grands alliés, le Canada et la France, et nous allons continuer d'être là les uns pour les autres.
En suivi.
Est-ce que vous condamnez, juste pour être clair, est-ce que vous condamnez la publication des caricatures du prophète Mohammed?
Non. Je pense que c'est important qu'on continue d'avoir et qu'on défende la liberté d'expression. C'est toujours important. Et nos artistes, nos chroniqueurs nous font réfléchir, nous mettent au défi. et ont une contribution extrêmement importante à notre société. Nous allons toujours défendre la liberté d'expression. We will always defend freedom of expression. Our journalists, our artists have an important challenge function in our society, and we need to leave them free to do their work. I have always believed that, and I've always said that.
Thank you. Operator, next question on the phone.
Thank you. Merci. Next question, Dylan Robertson, the Winnipeg Free Press. Line open.
Good morning, Prime Minister. Did Manitoba fail to prepare for the second wave of COVID-19?
My job is not to judge other jurisdictions and how they do things. My job is to be there to support them. We've sent over 90,000 rapid tests to Manitoba over the past little while. We've been there to send them more contact tracers, to give them more support on PPE, to help with isolation centers. We will continue to be there. Through the summer, we sent $19 billion to all provinces and territories to be able to deal with and prepare for a second wave. We sent we sent $2 billion to help with a safe return to class for our students in the beginning of September. We will continue to be there to provide the supports. Jurisdictions make determinations on how to act, and how to shut down, and where to shut down, and when to shut down. Our role as a federal government is to make sure that they have all the support and equipment necessary. As Minister Freeland pointed out, the decision by the federal government to be there with income supports for people who lose their jobs, with direct support for small businesses who are forced to reduce or to shut down, including help on rent with a top-up for when there are mandated shutdowns. These are all things that are designed to make it easier for public health officials in local jurisdictions to make those decisions quickly, to protect people's health, to shut things down and know that people will be there to support. People will be supported.
Following up.
And Prime Minister, the COVID-19 funding for schools in Manitoba still hasn't flowed. The provincial government says it hasn't actually received the funding and that it's supposed to ration that funding through the school year and not just the winter. I'm wondering if that's accurate or if Manitoba is being intransigent.
We have certainly moved very quickly to flow supports to the provinces. That $19 billion we transferred to the provinces in September for everything from protection to the most vulnerables, to extra PPE, to support for more testing, to support for municipalities is money that is available now for all provinces. And on the Safe Back to Schools, I know many provinces have moved forward in investing them, and we will follow up to ensure that Manitoba is able to do what is necessary to keep kids safe as they return to schools.
Thank you. Operator, we'll take one last question on the phone today.
Thank you. Merci. Prochaine question, Hélène Buzetti, Le Devoir. À vous.
Oui, bonjour, Monsieur Trudeau. J'aimerais simplement revenir à la question de mon collègue de TVA. Ce n'est pas clair dans ma tête. Avez-vous vous aussi reçu un appel d'Emmanuel Macron comme Monsieur Legault? Et voilà, allez-y.
J'ai exprimé mes condoléances, mon appui pour le peuple français et je m'attends à parler avec le président français dans les moments à venir.
Alors, le fait que vous en avez, j'en conclus que vous n'avez pas reçu un appel, donc faut-il comprendre cela comme un désaveu de la part du président français quant à votre position sur la liberté d'expression?
Je pense que c'est tout à fait naturel que suite à un terrible attentat comme on a vu ou une attaque comme on a eu samedi soir à Québec, qu'il y a des expressions de condoléances. J'ai une longue historique de bien travailler avec le président Macron sur des enjeux importants pour nous tous et je vais continuer de travailler avec lui en tant qu'allié. We have long worked together, the President of France and myself, on a broad range of issues that matter deeply to our citizens and to the world, whether it be fighting terrorism or standing up for human rights. We will continue to do that.
Merci. On va maintenant passer aux questions dans la salle.
Louis Blouin de Radio-Canada. Vous avez dit ce matin à la radio que le choix des Américains ce soir pourrait avoir un impact sur la trajectoire de la crise sanitaire. Comment?
Je pense que c'est très clair que malheureusement aux États-Unis, il y a eu un certain débat politique autour de la COVID-19. Ici au Canada, on a été extrêmement chanceux que tous les différents paliers de gouvernement ont pris une approche alignée. On travaille ensemble en tant que partenaires et on est tous en train de faire tout ce qu'on peut pour protéger tous nos citoyens d'un bout à l'autre du pays. Le fait qu'il y ait eu des débats politiques autour de la réponse à la COVID, je pense, ont été une partie du défi auquel sont en train de faire face les Américains maintenant. Et c'est certain que cette réflexion a eu un impact et va continuer d'avoir un impact sur le choix électoral des Américains. I think we are extremely lucky in Canada that all different orders of government and, for the most part, political parties have worked together to be there to support Canadians, to support our scientists and our frontline health workers, to work in a coordinated way to be able to fight this COVID-19 pandemic and continue to. In the United States, we saw that there was significant political debate around how to engage best with COVID-19. And obviously, that is something that is at play in this election.
Ron Oliver with CTV National News. A few months ago, Ontario's premier encouraged anybody in the province who wanted a test to go get one. That created mass problems with testing. You and other officials have encouraged Canadians to get a flu shot. In Ontario, its estimated demand is up 500%, and supplies are very low or non-existent. I'm wondering what lessons your government is learning from these surges in demand that will ensure that Canadians who want a vaccine when it's available is able to get one, and also what is your government doing to increase the flu vaccine supply?
In regards to the flu vaccine, first of all, we encourage everyone and continue to encourage all Canadians to get that flu vaccine. We learned from other jurisdictions like Australia and New Zealand who face their flu season in the spring because their seasons are the opposite of ours, that the flu virus and the flu vaccine is an extremely important measure in terms of not doing any of keeping people healthier and preventing our frontline medical systems from being overloaded. We, as a result, ordered larger numbers of flu vaccine than ever before. Of course, we will continue to ensure that it is available for people across the country. We're working right now with Ontario to make sure that we are getting to them the necessary doses. Obviously, there's a strong demand for flu vaccine around the world right now, but Canada continues to ensure that we're going to have enough flu vaccine for everyone. And these are, of course, all lessons that we are keeping very close in mind as we move towards an eventual, hopefully sooner rather than later, rollout of vaccines once they are developed.
Michael Couture from Global National. I wanted to ask you, are you going to be watching the results of the U.S. election tonight? Possibly, will you be staying up late? And take me inside the room for a second. What are you or your office looking for in terms of results before you make that congratulatory call south of the border to either one of the candidates?
I think many people will be watching the elections tonight. I will certainly watch part of them, but we also know that there is a possibility that we won't know results until tomorrow morning or even later in the week or even longer than that. That is something that has happened before in terms of American elections. Many of us remember the 2000 elections that took a number of weeks before determining who would be sworn in January. We're going to continue to, watch and make sure we're standing up for Canadian interests every step of the way. But we will allow the American elections, obviously, to unfold as they will, and Canada will watch. Je pense que nous savons que des fois, des élections, ça prend plus longtemps que d'autres pour avoir les résultats. Il y a l'exemple de l'année 2000 où on a dû attendre des semaines avant de savoir qui allait être le président inauguré au mois de janvier. Nous allons évidemment regarder ce qui se passe aux États-Unis ce soir et dans les jours à venir si nécessaire. Oui, je vais écouter en partie les résultats, mais on sait qu'il ne va peut-être pas avoir des résultats avant quelques jours.
Hi, Prime Minister. Tom Perry with CBC. I'd like to ask you also on the U.S. election, do you think that the United States has changed over the past 4 years? And I wonder if you think if it has changed, if some of that change is going to stay permanent no matter who wins today or in the coming days.
I think over the course of years and decades, all of our countries change. There are ebbs and flows of different factors. There are choices made by American presidents that are the reflection of movements and expressions of will within the American people. These are all things that are important to Canada to keep an eye on, to watch for, to try to figure out how to best defend Canada's interests. Over the past 4 years, we've had to renegotiate our most important trade deal in NAFTA, and we were able to come through that very strongly. We needed to stand up for our steel producers, for our aluminum producers, and push back against unfair tariffs from the United States, and we were able to do that. We've continued to work alongside them in multilateral fora and on the world stage, and we will continue to do that. Obviously, elections matter, and we will watch the results of this one, but Canada is well-positioned and ready to continue to work with the American people and the American government, regardless of the outcomes of tonight. Je pense que nous savons tous que les pays évoluent et font des différents choix pendant différentes élections. Et notre responsabilité en tant que Canada, c'est de toujours être là pour défendre nos intérêts et nos valeurs. Et c'est exactement ce que nous faisons depuis bien des années. Depuis 4 ans, on est là pour défendre le commerce avec notre partenaire le plus important, avec la renégociation de l'ALENA, qui a eu de bons résultats pour le Canada. On a été là pour défendre nos travailleurs d'aluminium, nos travailleurs d'acier contre les tarifs injustes que les Américains avaient mis et on les a vus enlevés de façon unilatérale par les Américains. On va continuer d'être là pour défendre nos intérêts, quels que soient les résultats. C'est ce à quoi les Canadiens s'attendent de nous.
Good afternoon. I'm curious, over the summer, it seemed that you were winding down some of your aid programs for COVID-19, and now we're starting to see you ramp them back up again. I'm wondering if maybe the information you were giving wasn't predicting the second wave to be as bad as it is, and that's what's changed it, and if you have any sense of how many jobs or businesses these new measures will actually prevent from closing.
Well, we knew throughout the summer that it was going to be important to keep things adjusted. In the spring, the Canada Emergency Response Benefit was designed to keep people at home, to keep them safe, because that was what we knew needed to happen. With a national shutdown, we needed to be there to support people as they stayed home. But we knew as the summer rolled out that people were getting back to work, people were starting up again, and we needed to make modifications to better support with slightly more fine-tuned tools the reality that people were facing, which is why we announced through the summer that we were going to be extending the wage supports to the fall, right to Christmas. Even though we didn't know for sure that a second wave would come, we had a feeling that it would be necessary, and therefore we did. And even before that second wave hit, we've announced that we're going to be extending our supports until next summer. But those supports, as the Finance Minister and Deputy Prime Minister has pointed out, are adjustable. We know that different businesses are hit differently. Some businesses are doing very well despite the pandemic, from being able to pivot, from being able to respond, from being able to be creative about their responses. Others, no matter how creative they get, are going to be suffering because of the nature of their businesses. Therefore, we have to have more flexible tools to both encourage people to work when they can, but recognize that many people won't be able to, and provide the right mechanisms, which is why a switch towards EI was the right movement. But also for our business supports, understanding that different levels of supports will be needed for different industries and different businesses. That's why we've given the predictability to next summer. One of the things we're seeing around the world right now is people are having to restart programs that they had let stop, or they had stopped perhaps too early, and that's causing a little bit of confusion and extra difficulty. Canada never stopped supporting small businesses. Canada never stopped supporting our vulnerable Canadians and Canadian workers. That's the commitment we made to Canadians from the very beginning of this pandemic, and that's the one we hold to. We have your backs for as long as this takes, whatever it takes. The Government of Canada will be there to support Canadians until the end of this COVID pandemic. That is the commitment we made. That is what we're going to continue to do.
And Prime Minister, do you mind if I jump in?
Of course, Chrystia.
I would just like, if you guys don't mind, to sort of build on what the Prime Minister has said. And just to say, I disagree with the premise, part of the premise of the question. Our government absolutely has understood that coronavirus wasn't over in the summer. And as the Prime Minister has just said, we knew we were going to need to continue to be there for Canadians, for Canadian workers, for Canadian businesses, for Canadian provinces and territories. And we knew we needed to be there for a second wave. That's why, as the Prime Minister has said, we put in place the very generous support in the Safe Restart Agreement for provinces and territories, $19 billion. That's why another $2 billion has gone to support the safe reopening of schools. And crucially, as the Prime Minister has said, that's why in the summer, in August, we announced our intention to extend the support for Canadian workers moving into the EI platform, and with the new CRB benefits, that support would last until the fall of 2021. And that is why we announced in the throne speech that the wage subsidy would extend to the summer of 2021. So we have understood that we need to be there for the long haul. And the business support measures that we put forward in Parliament yesterday are about doing precisely that. And what the Prime Minister has just emphasized is, in order to be there for the long haul, we've created this real network of mutually reinforcing measures that are simplified, that are built on robust platforms, that are going to get us through to the summer and the fall. The EI and the new emergency benefits, they're already there. They had unanimous support in Parliament. And now we have this suite of business support measures: wage subsidy, rent subsidy, lockdown support, enhancement to CEBA. These measures all work together. They are delivered on robust platforms. They've been simplified so that they are mutually reinforcing. As the Prime Minister said, they are flexible and automatically adjust. So we will be spending more on EI and more on the CRB and more on the wage subsidy and more on the rent support if it turns out that the second wave is really, really rough and people need more support. If we get through it, if we do the right thing, if we listen to Dr. Tam and Dr. Njoo, and we're all able to keep working, then we will spend less on these programs. They are automatic stabilizers. So we've really worked hard to put in place a set of measures that work together, that are simplified, and that crucially will get us through to the summer and the fall.
Thank you, Deputy Prime Minister. Prime Minister, this is all the time you have with us today. Thank you very much. We will now go back to the phone for 2 questions and finishing up with the room for 12:45. Thank you. Opérateur, prochaine question au téléphone, s'il vous plaît.
Thank you. Merci. Prochaine question. Next question, Dylan Robertson, the Winnipeg Free Press. Line open.
Hi there. A question for Dr. Tam. I wanted to ask about the use of antigen versus PCR rapid tests. Is there a different criteria of when these should be used in general? And as a theoretical, when you have a remote communal workspace of an existing outbreak, is an antigen test adequate for screening positive cases?
So PCR is the sort of standard, if you like, the gold standard for testing. And so, but, you know, to augment that capacity, antigen testing can be done if, particularly in places where there's not enough access to laboratories. So any kind of rapid point of care test, that's you know, key attribute. And if you already know there's an outbreak, you can use, I think, an antigen test to support that outbreak response and try and detect individuals who may be part of the cases that need to be isolated. So I think that's useful. Of course, negative tests, depending on your epidemiologic situation, may not tell you a lot. You still have to use public health judgment in those situations as well. But I think antigen testing can supplement the outbreak response. And that long-term care, maybe outbreak and work settings, that's one of the you know, potential uses. But in general, if you want to have precise diagnostics, then we advocate the use still of the PCR.
Thank you. No follow-up.
Thank you, Dylan. We'll go to Opérateur. Prochaine question au téléphone.
Thank you. Merci. Prochaine question, Lina Dib, La Presse canadienne.
Oui, bonjour. So my question is for you, Dr. Tam. I don't quite understand why have you changed the directive of the masks now that they need to be 3 plies, 3 épaisseurs. Could you explain where the science comes from and what will we do with all these masks that are produced now, sold and worn? Should they all be sent to the garbage and we start over?
Yes, so we're not necessarily saying just throw out everything that you have. I think nobody's really studied non-medical masks in the past, so there's been actually more research into different materials, the number of layers, and particularly the fit. And I keep emphasizing the fit is one of the most important things. I see many of people in this room actually has a very good, well-fitted mask. You know, it's pinched at the nose, it fits all around your mouth and your nose, and it has to cover your mouth and your nose. So that's really important. And we already have recommendations on materials for the 2-layer mask, but it's more and more recommendations, even internationally, that adding another layer of what we call a filter layer could add to that protection. So it's an additional layer of protection, particularly if you have high-risk medical conditions and other risk factors. Then adding another layer of protection, I think particularly important right now as we're all moving inside. I think any additional layer of protection we are now recommending. The filter that we are talking about can be inserted into the 2 layers of, if you had cotton, you know, tight weave cotton, it can be inserted in the middle. Or there are actually other constructions that will be on our website. For example, one of the kind of filter materials is non-woven polypropylene, which is like an interface. I don't know if people who sew, I don't, but now I've learned about interfacing. That kind of material can be inserted and ironed on, for example, and as part of the construction can then be reused. You can also buy some filters that are available. So this is an additional recommendation just to add another layer of protection. But I have to say that the science of masks has really you know, accelerated during this particular pandemic. So we're just learning again as we go. I do think that because it's winter, because we're all going inside, we're learning more about droplets and aerosols. It's just another layer of protection.
C'est Dr. Peut-être, c'est Dr. Peut-être ajouter quelque chose aussi en français. Comme Dr. Tam a constaté, même le port d'une masque, c'est comme une couche de protection. Mais c'est aussi important de garder les autres mesures de santé publique éprouvées, comme la distanciation physique et aussi la bonne hygiène de se laver les mains. Donc, même pour le port de masque, maintenant, on sait qu'avec les données probantes, la science qui continue à évoluer, que Oui, peut-être que c'est bon d'ajouter même une autre couche, même pour le port de masque, comme quelque chose, un matériel filtrant. Mais un autre peut-être message important à ajouter, c'est avec le météo, avec l'hiver qui commence à arriver ici au Canada, je pense que c'est une bonne idée aussi d'avoir le port de masque à l'intérieur, à toutes les occasions, sauf si on est chez vous, à votre résidence, avec les membres de votre ménage. Même s'il y a des visiteurs qui arrivent à votre domicile, c'est important que peut-être tout le monde porte des masques à l'intérieur. C'est seulement avec les autres membres de votre ménage que vous avez comme un contact étroit tous les jours que peut-être ce n'est pas nécessaire à l'intérieur. Merci.
Okay, so Dr. Tam, if I can go back to the science that you were talking about. So are you saying that this filter will protect against the aerosols, or you're not going there?
Well, it will increase different ways of catching droplets of different sizes. So, it may not filter everything, but a well-fitted non-medical mask will filter a lot of the different droplets of different sizes. So that increases for sure. It will increase another layer of filtering out those droplets. So that is one of the reasons. So scientists have, used different combination of things in different layers. In general, the more layers, potentially, the better if you use the right materials, but it also has to be breathable, and comfortable and well-fitted. So that's why these recommendations continue to evolve. I mean, you can put many layers, but then it won't be as breathable, and then people can't use them. So this is the latest recommendation. But I do have to emphasize the fit. The fit is a really important aspect of the whole setup. But as Dr. Njoo said in French, that this is one layer of protection. You have to observe all the other public health practices. One difference, another thing that we want to emphasize today is that just also to make things simpler, when you're coming indoors, never mind 2 meters, however meters, just wear the mask when you're not with people in your household. That will help prevent droplets or aerosols more so than if you were just relying on the 2-meter distance. Again, adding another layer. So, but it does actually simplify the message. Many jurisdictions, municipalities have already said, wear a mask indoors, in indoor public spaces. So it's the same thing. So when you go out, put on your hat, your gloves, bring your mask, wear it when you're not with your household. That's the simplest message.
Thank you. We will now go back to the room, starting with Monsieur Blouin.
Une question pour Madame Freeland, Louis Blouin, ici de Radio-Canada. Vous avez beaucoup vu de proche la relation canado-américaine, ce qui se passe aux États-Unis depuis les dernières années. Est-ce que vous craignez des débordements, des violences en marge du scrutin? On a vu que le climat est très, très tendu aux États-Unis. Qu'est-ce que vous auriez peut-être à dire aux Canadiens qui sont aux États-Unis en ce moment, peut-être qui s'inquiètent? Qu'est-ce que vous pouvez nous dire là-dessus?
Merci pour la question. Et j'ai eu hier une excellente conversation avec Kirsten Hillman, notre ambassadrice aux États-Unis. J'ai une chose à dire, et c'est que je veux assurer tous les Canadiens au Canada et aussi les Canadiens qui sont aux États-Unis que le gouvernement du Canada est prêt. Une des choses qu'on peut décrire comme une spécialité de chaque gouvernement canadien, et peut-être surtout le nôtre, c'est de savoir comment travailler avec les États-Unis et de comprendre que c'est pour les Américains de choisir leur gouvernement, mais c'est pour le gouvernement du Canada de savoir comment travailler avec le gouvernement qui est choisi par les Américains. On a démontré, je pense, dans les 4 dernières années, qu'on sait comment le faire. Et je veux assurer les Canadiens qu'on a les plans pour toutes les éventualités et on sera prêt à continuer de faire ça. Et absolument, une des responsabilités pour le gouvernement du Canada, c'est d'être là pour les Canadiens qui sont à l'étranger. Et on sera là pour eux aussi. Merci.
En anglais, peut-être, Madame Freeland? Mes collègues me demandent l'anglais.
Okay. So, thank you for the question. I had a very good conversation yesterday with Kirsten Hillman, our terrific ambassador to the United States. She's our woman in Washington. And I really would like to assure Canadians today that our government is absolutely ready, and we have thoughtfully prepared for all eventualities. And I am really confident that we have a plan no matter what happens. I think it's a reality for Canada that every Canadian government needs to be a specialist in working with the United States, and that has certainly applied to our government. I think over the past 5 years, our government has shown that we are able to work with the United States, whoever the American people choose to govern the United States. And I really want to assure Canadians that, just as we were ready when we came into office in 2015, just as we were ready in 2016, we are ready today. We absolutely respect the choice that the American people are making today, and we will be ready to work effectively with whomever they choose as their government. You asked specifically about Canadians in the United States, and that's a good question. It is absolutely a responsibility of our government to be there for Canadians outside our country, and we'll be there for them too. Thank you.
Ma question de suivi, Madame Freeland, quel est le risque pour l'économie canadienne si, par exemple, le résultat de l'élection est contesté et s'il y a de l'instabilité politique qui s'étire sur plusieurs semaines, si le résultat de l'élection est contesté par un candidat ou l'autre? J'aimerais savoir, à vos yeux, quel est le risque pour l'économie du Canada?
Encore une bonne question. Et une des raisons pour lesquelles nos relations avec les États-Unis sont si importantes est à cause des liens très, très proches économiques entre le Canada et les États-Unis. Je veux souligner qu'on a fait beaucoup pour maintenir pour l'avenir ces liens avec l'accord de Nouvelle-Alena. Ça nous donne une grande garantie en tant que pays qu'on aura des liens stables, des liens avantageux pour le Canada en tout cas. Je veux citer un rapport économique de TD Bank il y a quelques semaines. Et ils ont écrit, et c'était une analyse de l'état d'économie canadien et américain maintenant et de notre réponse économique due au coronavirus. Et le banque a constaté que les Canadiens nous disons toujours que, et je vais le citer en anglais si vous me permettez pour être exact, on a une phrase que je pense que tous les Canadiens connaissent. When the United States sneezes, Canada catches cold. Mais les économistes de TD Bank ont constaté que maintenant qu'on en regarde la relance économique au Canada et aux États-Unis, et surtout quand on regarde la réalité que la relance économique en ce qui concerne les emplois est plus robuste au Canada qu'aux États-Unis. Les économistes de TD Bank ont dit que peut-être aujourd'hui, on peut dire when the United States sneezes, Canada develops antibodies. Et je pense que c'est une approche importante pour notre pays. C'est un grand avantage économique pour nous d'avoir un accord de libre commerce avec les États-Unis et d'être si proche, d'être voisin avec l'économie la plus grande dans le monde. C'est donné beaucoup au Canada et se donnera beaucoup au Canada. Mais en même temps, c'est important pour nous d'avoir une diversité des relations économiques dans le monde. Mary travaille très fort pour créer ces liens et nous devons faire ça aussi. Merci.
Thank you, Deputy Prime Minister and Minister of Finance. We have time for one last question in the room before ending this presser. Thank you.
Hi, my question is for Dr. Tam or Dr. Njoo. Either one of you can answer. Ottawa's top public health officer is telling residents that we really need to learn how to live with the virus. And she's suggesting that includes a loosening of restrictions on indoor dining and other quote unquote more controlled settings where people can gather. Now, this message is coming as many European countries enter a second national lockdown to try to get control over this second wave. So I'm wondering, what do you think about this idea of coexisting with the virus? And also, I'm wondering if you can kind of explain why it appears that guidelines are changing from encouraging people to stay at home and to only leave for essential reasons to go out but be cautious when it seems like cases are still rising in many provinces.
Yeah, I think we stressed that each of the local public health officers may need to adjust to what's going on in their environment. So I think adapting to, living with COVID-19 is something that we have to do because it's not going to immediately disappear and the population doesn't have much immunity. So we know that. And so these adaptation, adjusting our lives, developing some of these habits like wearing a mask and observing these public health measures, I think is as I said this morning, is a sort of habit that we need to sort of develop. Businesses have to adjust and see what they can do to minimize risks. It's a bit like a sort of harm reduction approach, if you like. And in some businesses or in some jurisdictions, it may be working. I don't know, because I actually think that even within Ontario, there's different municipalities that experience different events. And they may have different capacities to ensure that restaurants are complying as well. So there may be a lot of different considerations. So Dr. Etchers obviously knows her municipality better than any of us would, and she is advising accordingly. So I think it's a matter of adaptation and seeing if it would work. But if cases do occur and accelerate in a community, then you have to get at it early. Because if you let the virus and the numbers accelerate and keep accelerating and then act, you would then end up with more widespread closures. So I think as cities or hotspots cool down, if you like, the restart needs to be carefully thought of. And then the next time, if there was any acceleration, you've got to titrate your community transmission activities. I think one reason why I think each of us have to develop good personal habits is to be able to keep some of these spaces open. So if we all reduce the overall contacts that we have and reduce the viral activity and the viral load in your community, then some of these spaces could potentially open as well. So it's a bit of a balance, and we just said it's a very difficult balance. But if everybody do their part, there's actually an increased probability of returning to some of those previous activities.
Hi, we're going to get one more question. Tom Perry with CBC. I just had a question about, Dr. Tam, about your guidance on the three-layer masks. I was just looking at a WHO statement that came out in June, and it said, and this was about general mask wearing. It said, based on new research, WHO advises that fabric masks should consist of at least 3 layers of different materials. So are what you're saying today different than what they said in June?
No, I think it's in line with that recommendation, and and it's about also not just the number of layers, but the different materials. There's been increasing research on the types of materials as well, the CDC, I think, says 2 or more. So there's different sort of permutations, I think, of an alignment in recommendations. But it's an area of evolving science. So I think just to forewarn that maybe we'll have another, evolution in knowledge in a number of weeks or months as well. So, and we will, but our approach also in Canada is to consult as many people as we can and make it practical. The timing is important, I think, because of returning to indoor spaces. And as we learn more about the different sizes of droplet, the more layers that you have is going to filter out more of those droplets as well. So that's why I think at this time we are evolving our recommendations along with the context and the evolving science.
Thank you. This is what ends today's presser. Thank you very much, everyone, ministers and doctors.